Give the call to the Honourable the Leader of the Opposition.
Thank you, Mr Speaker. My question is to the Minister for Aged Care, and allow us to assist the new minister. Of Labor's promised 83,000 new home care packages, 0 have been delivered. Meanwhile, more than 200,000 Australians are still waiting for either a home care package or an assessment of a package. Will the minister apologise to these 200,000 elderly Australians and their families for this betrayal?
Order. Call to the Minister for Aged Care and the Minister for Seniors.
Thank you, Mr Speaker. I thank the Leader of the Opposition for her question, and I can perhaps assist the Leader of the Opposition to better understand some of the matters to which she refers to. Firstly, the Support at Home program, to which the Opposition have been supportive in moving the initial legislation, provides the legislative framework for support at home. So the members opposite will understand that the legislation they voted for is a requirement for support at home packages to be delivered. So those 83,000 can begin to be delivered from the time that the legislation comes into effect. Secondly, as I mentioned before, in the meantime, we continue to deliver packages each and every single week, the average being above 2,000 packages per week, to ensure that, in the meantime, Australians continue to receive the care that they need. We will ensure that every single Australian who is assessed as high priority will continue to receive their package within a month. And from November 1st, we will continue to invest in the Support at Home program as the key mechanism for delivering the in-home care that older Australians tell us that they want.
Give a call to the Honourable Member for Macarthur.
Thank you, Mr Speaker. My question is to the Minister for Health. How is the Albanese Labor government ensuring that life-changing medicines continue to be listed on the pharmaceutical benefits scheme? Why is this so important?
Give the call to the Minister for Health and the Minister for Aged Care.
Thank you, Speaker. Before I answer that, I wonder whether, on indulgence, I can welcome the red T-shirts to the chamber. People with lived experience of early onset bowel cancer. Rates of this are exploding in Australia and many other countries around the world. They've come to Canberra talking to members across the chamber about their deeply powerful personal stories. And on behalf of the chamber, Mr Speaker, I'd like to thank them for doing that over the course of today. Now, I thank the member for Macarthur for that question. He knows very much about the PBS, and as the Prime Minister said, it truly is one of the core pillars of Australia's world-leading healthcare system, yet another feature of our healthcare system introduced by another reforming Labor government almost 80 years ago, Mr Speaker. It delivers access to the world's best medicines at affordable prices. And this government has been working hard to make those prices even more affordable, Mr Speaker. 4 waves of cheaper medicines policies in our first term of government have already saved Australians more than $1.5 billion in co-payments at their pharmacy counter, Mr Speaker. But those huge savings don't account for the huge benefit of 350 new or amended listings that we have made to the PBS in our time in government, Mr Speaker. The member for Macarthur, a deeply experienced paediatrician, for example, knows just how impactful asthma is to Australia's children and young people. Every day, almost 40 children are hospitalised through asthma, and tens of thousands more struggle with everyday activities like playing sport or playing in the playground. Today's the beginning of National Asthma Awareness Week, so it's a terrific day to announce a new PBS listing that takes effect today of Dupixent, a highly effective medicine for serious asthma which is not responding to even quite high-intensity treatments, Mr Speaker. Kids like Jack, who is a 10-year-old from south-western Sydney, first admitted to the Campbelltown Hospital when he was just 3, but even on a preventer inhaler, Mr Speaker, Jack's mum has been saying he couldn't play sport, couldn't run around with his friends at birthday parties. But several months ago, he got early access to the Pixent, Mr Speaker, and his mum, Sarah, said recently, "It's been a miracle." Last week, we had our school sports carnival and Jack came third. Previously, he wouldn't have even been able to take part, Mr Speaker. That's the beauty of the PBS. Before today's listing, Jack's family would have paid $11,000 a year for that. From today, they'll pay $31, and from the 1st of January next year, if the Senate passes our bill, they'll pay just $25, Mr Speaker. Great for Jack's health, but also great for his family's hip pocket.